I'm Roger Baker, Executive Director of the Stratfor Center for Applied Geopolitics at RANE, a global center of excellence for geopolitical intelligence and analysis. Learn how you can put geopolitics to work for your organization at ranenetwork.com.
Welcome to the Beyond COVID podcast from RANE Network. In this podcast series, David Lawrence, the founder of RANE, speaks with Dr. Fred Southwick, an infectious disease specialist at the University of Florida's College of Medicine, and Dr. Bill Lang, an expert in public health responses to biological incidents about the infectious disease landscape.
Fred and Bill, thanks for joining us, and maybe the good news is that many of the topics we previously discussed have been covered, and there does not seem to be any significant health issues out there that are pressing. One thing which is, very much here in the country, and we've heard from clients who've had people who've, basically been out sick, and it's a very, very tough illness. Fortunately, it passes. But maybe you could bring us up to date about the Norovirus and sort of what the symptoms are, what people should be doing, and most importantly, how to prevent the spread of it.
Well, the biggest issue with norovirus is that exactly what you were just talking about. How do you prevent the spread of it? The problem with norovirus is it's a very tiny virus, and it only takes as few as 10 particles of norovirus to have a significant infection. To put that into perspective, it takes several hundred particles of SARS-CoV-2 to cause an infection. The other big problem with norovirus is that the coating on the virus is such that it is nearly impervious to many of the standard alcohols and detergents that we use to clean surfaces, at least at kind of normal quantities. So it gets out there. It's transmitted, it's a fecal oral transmission, but because of the small amount and because of the way it protects itself, it really takes thorough cleaning, very thorough hand washing to prevent it. The good news is that it is, while it makes people pretty sick, it doesn't tend to kill many people. It does kill some people who are, have other significant diseases, but it makes people miserable for 24 to 48 hours. So that's kind of why norovirus is a problem for us today.
Okay, and Fred, some of the symptoms, what you're seeing?
Yeah, you get severe nausea, vomiting, and watery diarrhea and severe cramping, as well as modest fevers. But people can feel very sick. They can get a little bit dehydrated. And in young children, it's a worry. As Bill said, the problem is it's pretty much resistant to even chlorine to some extent. And in the summer, it gets into swimming pools and can spread that way. And a little child that has a diaper and goes into a pool is notorious for spreading the norovirus. And the place that it really hit first were on cruise ships, where there are large buffets, and just a few particles in the buffet, and everybody gets sick. So it's often in foodborne, and it's also in daycare centers and nurseries are a major problem. And little kids are still on diapers. They are just the perfect storm when it comes to spreading norovirus.
And Bill, I heard you reference hand washing. I've read that the use of hand sanitizer, which obviously became commonplace during the pandemic, is not actually effective here.
Well, it helps, but washing and mechanically removing these particles is the most effective.
Yeah, you really 30 seconds of washing with soap and water is the best.
I still remember back from the days of pandemic influenza when we tell people, sing happy birthday to yourself. And that gives you the 30 seconds.
All right. And just in terms of cleaning surfaces, reference, it's not necessarily effective, but it's fully effective. But
Yeah, I mean, it helps, and the mechanical processes are helpful.
all right. And look, some of the people listening here, you say there's a virus, and people think, okay, is anyone doing anything about it? There have been some stories about Moderna working on a vaccine for this. Any thoughts? I think stage 3 of the FDA with respect to the norovirus vaccine.
Yeah, it's primarily being tested in the UK, but there are phase 3 studies. So, as we know from past experience, once you get to phase 3 studies, if they look good, you can get something out pretty quickly. So, I mean, there's a possibility we could see a vaccine within the next couple of years. Now, we know nothing at this point about how many vaccines, how long is the vaccine effective. None of those things. But having a vaccine would be useful in removing this annoyance. The one thing I do want to tell people, though, that if you get norovirus, you do not want to use something to stop you from having diarrhea, because it helps to let your system wash it out. That means you've got to stay on top of fluids. As long as you can drink, you're good. Make sure you're getting in plenty of fluids and electrolytes. So things like half-strength Gatorade, adult Pedialyte, which now exists, things like that is good. But you don't want to take Imodium to stop you from having diarrhea. You'll end up with having the problem longer.
And the other thing, David, as Bill referred, is a self-limited disease. Usually 3 to 4 days, maximum 7 days, in my experience.
Okay, but a hellish 3 to 4 to 7 days.
It can be awful. Yes, yeah. It's a severe watery diarrhea, and some patients have a lot of nausea and vomiting, which can lead to significant dehydration because they can't be treated with oral fluids.
All right. As an otherwise very strong and tough CEO said to me, who it went through his family, he said, David, I spent the first 24 hours wondering if I was going to die, and the next 2 days hoping I would die. So, yeah, it's not to be treated lightly. And so hydration, anything else besides staying away from, drugs like Imodium, making sure you're hydrated, anything else?
I think those are the primary treatments. There's nothing else. It's really supportive care.
Got it. Okay.
And if you do have it, you want to pretty much isolate yourself pretty thoroughly. Don't have dinner with the family. Don't go in and help cook. Just stay away from other people. Stay away from other food that other people are eating.
Okay. And just in terms of your intake of food, whatever you can tolerate a little bit, I assume.
Yes, and there's some thought that probiotics, including yogurts with probiotics, can help, because one of the things the virus does is attack your normal gut flora, and so that may help a little bit, but it's certainly not going to hurt.
Got it. All right, let me pivot with you guys. The first week of the administration, this is not going to be a political discussion, so let me forewarn the listeners. But in reviewing executive orders, there was an executive order that touched upon something called gain of function research. As a reminder, it came up during the pandemic days in terms of what might be the origin or the source of the coronavirus. And I thought it would be helpful, because we have had a number of questions about this, to give people what I'll refer to as a plain speak definition of what gain of function research is and why it has become, I'll call it topical, and something that the president now and the medical establishment has been giving a great deal of thought to. I don't want to go on either side of the argument, but I just think it would be helpful for people to understand what it actually is and why it is important.
Bill, yeah, maybe I can explain it because I've actually done research not with viruses, but done work with the various proteins on gain of function and loss of function. What you're trying to do is you're trying to determine what proteins or what structures in the virus are important for causing infection. There are two ways of inferring function. One is if you knock it out, then the virus would not function normally, and so loss of function is one way. Another one is to amplify a double one structure and make it and see it become worse or become more infectious. So there are two sides of a coin, and that had been the gold standard as far as research on structure function in the past.
And there's a long history of gain of function or development of highly toxic or virulent infectious agents, because that's the best way to develop the defense against this. So the Department of Defense has been involved in this for many years. You know, if you want to defend something, you've got to know what you're defending against and how to best do it. So that's been the argument for gain of function research. But what we saw was that without, let's see, how's the best way to do this not politically? That there is some concern that there was gain of function research that was being done, whether it was being done just purely academically or with other intents in mind. Taking that out of the question, there was some gain of function research being done, and some of the characteristics of COVID-19 had the appearance of possibly being related to gain of function research. So because of that, it has become very, very political. And so what the executive order that was signed on the first day of the administration said was that the government will temporarily halt the federal funding for certain types. And this is not a blanket ban, and it's not a permanent ban, but for certain types of gain of function research. And what the goal is over the next short period is to develop very, very strict and clear guidelines about when and how gain of function research is to be done. So hopefully I got that fairly apolitically.
Yes, you did. And just maybe to crystallize this a little bit, it is a form of research where you're taking a virus and seeing, Fred, I don't want to be overly simplistic with your explanation, but basically seeing what it is that can stop the virus, and also if the virus were to mutate in some ways, Bill, how to stay ahead of the curve and to understand what the virus could mutate into.
It gives you a potential, it shows you the potential
Range.
for higher virulence.
Got it.
And you can then predict what you should do as far as treatment for that. And it may, certain viruses that right now seem benign, theoretically could in the future mutate to gain function naturally. And wouldn't it be nice to know about that potential ahead of time so that the researchers can keep an eye on it? And the downside is that if you create such a gain of function, if it gets out of the lab and spreads, then you have actually produced a highly virulent and potentially deadly virus. And that's something we really do not want to have happen.
I think that's very clear, very apolitical, and highlighting why it is important to focus on what research is being done and what the controls are around the research. And implicit, Bill, in what you were saying, because we've dealt with biological warfare in the history, is that there is a reason why this research, like a lot of technology and a lot of other things, can be used for good, but it could also obviously have some very, very serious and dangerous consequences.
Exactly.
Okay. All right. I want to thank you both, and please, continue to keep us safe. People should still get their flu shots, I assume, if they haven't already.
Yes.
If they haven't already. Okay. Good advice, and keep washing your hands, and wish yourself happy birthday several times a day.
Exactly.
Okay, guys. Listen, thanks again, and also for your continued work.
Thank you, David.
Okay.
This was the latest installment of the Beyond COVID podcast from RANE Network. For more information about the RANE podcast series, or to discover RANE's wide range of offerings on risk intelligence, please visit ranenetwork.com. That's RANE network.com. Thank you for listening.